Welcome to Unit 402, Communication in Health and Social Care. And we're looking today at part 4 of the unit, which is confidentiality and data protection. And we're going to spend a little bit of time looking over the assignment as well. So the objectives we're working at, if you have a look at your assignment brief, is 2.3. We're going to talk about the importance of confidentiality, and we're going to reference the 7 Caldicott Principles within that. And then objective 3.2, we're going to explain the Data Protection Act. The one that's mentioned here is 2018. It has actually been superseded now in the late 20s by the GDPR. It isn't a lot different. I'm going to mention a little bit about all of them, but when you write your assignment, it does explicitly ask you to mention the 2018 one. Okay, so. But you can write about the GDPR as well, so that when I mark it, if you write about the updated stuff, I don't have a problem with that. Okay. So first of all, we have a little think about what is confidential information. It's a duty of confidence. It arises when some person discloses some information, generally quite personal, to another, like a patient to a doctor, for instance, or a patient to a nurse, in circumstances where they generally expect you're going to hold that in confidence. So if you imagine if it's a sort of private consultation, there's an expectation it will be kept in confidence. Confidential patient information is a legal obligation. There is case law around it, and there are laws that cover it. And also within all of our professional codes of conduct, be that medics, nurses, therapists, health and social care workers, it is included within all of our codes of conduct. So there's an expectation there as well, not just the legal side, but a best practice side as well. And certainly within the NHS, it's included within their employment contracts as well. And very often, if you with some of the bigger care home organisations, I know for sure it's in most of their contracts as well. So it depends how professional the organisation is. So we know that patients entrust us, or they allow us to take sort of fairly sensitive information about their health and other matters as well as seeking treatment. So it's not just about their health. So if someone's seeking treatment for something or seeking support, particularly if they're in social care, it could be about the way they live their lives, about the things that they're thinking about that's important for them, about their relationships, which people may have different views on, even about their political activity. Sometimes can be a bit of an issue. So it's important that they know that how this information is going to be used. We need to be seen to be providing a confidential service, and we have this duty, even if some people are more relaxed about it and will be talk about sort of private things sort of in a very public way. That might not be the same for everybody. So we have certain sorts of information that we try to keep confidential, even if the service user is a bit random about who she chooses to discuss it with. One of the consequences of the information is that it can identify people, and some negative issues could come out of that. So they can't be used in other areas, really. They can't be used to market stuff, because we know that a lot of social media uses sort of information to market various products to you, which is sort of something that's still being discussed with Facebook, Google, Insta, those sorts of people. Whether or not they should actually be able to do that, that stuff is still under discussion. But certainly, when we're a sort of professional organisation, you wouldn't be allowed to use it to market people's preferences, so they get inundated with, I don't know, if you're in a care home, like lots of slippers or sort of walking canes and things like that. We wouldn't be allowed to do that. Okay, as I said, it is actually backed up by a legal basis. And most important is any information that you do share wider, say you might be involved with a piece of research, for instance, which is, valid and can be useful. You shouldn't be able to identify the individual, or anyone who reads it shouldn't be able to sort of find a way to contact the individual or know too much about them in that respect. I've added a document with the NHS Code of Practice on it for you. It will be in your attached reading, so please do have a good look. I've added a fair bit of attached reading for this session that I'd like you to take your time and have a look at and make yourself familiar with. So we talked about Caldicott Principles. Some of you may not have heard of Caldicott. Why is it called Caldicott? Well, it's named after a lady called Fiona Caldicott. So it's sort of that simple, really. And she was asked to chair a review about the sort of management of personal information, and how good it was or how bad it was, and what needed to be improved. And this is a little quote from Fiona Caldicott after her first review, which she did in about 1996-97. She did a review of all patient identifiable data for the NHS, and coming out of that, her and her team that who carried out the review, they came out with 6 recommendations to how to protect people's confidentiality, and they became known as the Caldicott Principles. Whenever you hear Caldicott, it's her fault. It's her name, really. They also included a recommendation that all organisations should appoint someone to take responsibility to making sure all these things are met, and that information is secure, be they big or small. So obviously, a big NHS hospital would have something known as a Caldicott Guardian. It's a sort of quite a nice name, really, but their job is really to sort of keep on top of the fact, reviewing to make sure that people are meeting the original 6 principles. And even in a small care home, there's an expectation that role is carried out, and very often it's carried out by the manager, or they might delegate it to one of the sort of team leaders or something like that. But there is usually somebody carrying out that role. They may not do it quite as formally as in the NHS, where they have huge teams and a huge amount of patients to deal with, but they still have a responsibility to make sure that all the principles are being met. And they have to show some evidence when CQC come to visit. It's important that they show some evidence of what they've done, and if anything's gone wrong, what they've done to sort of change it, really. So a few years later, Fiona Caldicott was asked to sort of do a follow-up review, really, just to see how well principles were being developed and being delivered. Okay, and to make sure that the people's information was still, as safe, or preferably safer than it was. So she chaired another review in 2013, and to do that, she added some principles coming out of that, really, and she also identified areas where the NHS, particularly, she did most of her reviews in the NHS, was stronger or weaker. So now there are 8 Caldicott principles coming from her review, and they're all focused about good information sharing and about how data is collected, how it's sort of looked after, what is being collected, and how it's used, really. And they are a guide for organisations mainly and their staff. So, you know, and how to sort of carry out the role correctly. But really, I mean, service users and their families are also partners in this, and they need to sort of maintain a reasonable amount of confidentiality as well. If someone comes in to see you in a care home, they might overhear some conversations about another service user. You know, we have to remind them that they're bound by that same sort of confidentiality as you are as staff members. I mean, they may not get the same sanctions on you if you do something wrong, but really they need to respect other people's personal information as well. So they do need to be reminded of that at times. So I'm going to talk through each principle and just so that you're aware of it. So principle 1 is to justify the purpose. So why are you keeping this confidential information? So you need to scrutinize and be really clear why that piece of information is there, and it is only there because it's needed. The Caldicott Guardian will check information every now and then just to make sure that people are not putting in things that don't need to be there. Personal information aren't really wanted in that sense. So just sort of think about that. If you're coming to see your doctor about your kidney stones, for instance, does the doctor need to be writing much about your sexual orientation? So think about that as well. Okay, so why is information there? And if they branch into something about people's personal lives or their attitudes or their feelings towards other things, is it there for a valuable reason? Principle 2, you only use confidential information when it's necessary. So if you're writing a report about someone, you have to think about, do you need to put someone's address in it? Yeah, yes, maybe if something's going to be sent to them. But otherwise, does it need to be there? Do you need to put someone's phone number in it if you're just writing a care report or if an OT's come in to do a report on a little bit of work, a little session they've done, what do they need to write in there? How much personal information needs to be written in there? So again, it's only used when it's necessary. Principle 3, use the minimum amount as necessary as well. So again, when you're writing your report, you don't have to repeat some very personal information over and over again. It just needs to be there for a given function. Access to confidential information should be on a strict need-to-know basis. So who can have access? Most important thing is that if you're working in a care home, it is not appropriate that the files are available or there is no password protection or the cleaners can sit down and sort of read someone's personal information. That would not be appropriate. Okay. The chef may need to know about people's dietary needs, but they don't often need to know other personal information. So just need to think about that. And you may need to split information. So if there's some parts of a care plan that needs to be again shared with the kitchen staff, because people have dietary requirements, for instance, be aware that you only need to share that. You don't need to share other stuff about people's sort of bodily issues that are not at all relevant. Principle 5. Everybody with access to confidential information should be aware of their responsibilities. And that includes patients and service users as well. Service users shouldn't be looking into, medication charts of other people unless they choose to share it with them. Then it's sort of up to them. You can't really stop them. but they shouldn't be sharing information with their family. So they may have heard that someone has a certain, like a terminal illness, for instance, and then they go and tell their family, who go and tell somebody else in the neighbourhood when that person didn't want them to know, for example. Um, Also, staff need to be aware that they have to take responsibility. So if somebody takes the notes home to do some extra work on it one evening and then ends up leaving it on the bus for anybody to read, and you may laugh at that, but it's happened loads of times. If it's not the bus in the UK, it's the tube. And people read medical records because people read anything on the tube. So people need to know it's their responsibility. If they've done it, it's not the manager, it's not the processes. If they wantonly took that information away and did not look after it, they shouldn't actually be taking it off the premises anyway. That's usually that would usually be written in your confidentiality policy, which is why every organisation, no matter how small, should have a confidentiality policy. It doesn't need to be huge. It just needs to have some of the main Caldicott principles in it so that people are very clear. So there will be disciplinary action if someone doesn't take their responsibility. It's not their manager's fault if they've walked off and left the notes open for anyone, any Tom, Dick and Harry to read. It's their responsibility. Principle 6 is to comply with the law. So, as I said, the confidentiality is actually enshrined in law. It's part of the Data Protection Act, which is an act, which is so there is legal sanctions on it, and handling of confidential information must really follow some of the statutes, really. And that is what we've talked about not sharing it. And generally the assumption is it's going to be locked away. If it's electronic, which very often it is now, it does make it a lot easier to keep sort of hidden, because you're not actually sort of walking about with it anyway. But you need to have a password on it so that people can't get into it. Now, we do know that people can hack into things, but as long as you've done all that's reasonable, so you've got proper decent passwords, and you would be advised on this by the people who manage your software. But as long as you put proper decent passwords in it, it's not really your fault if someone hacks it. Only if you haven't bothered to put a password. Okay. Legally, there are some times when you have to share confidential information with the police, even when your service user might not want you to, and that's usually as part of evidence if a crime has been committed. So you will have to tell them that. If one of the service users has been physically attacked by somebody else in the care home and the police are called, they might be embarrassed about where they might have been attacked, and they might not want to show it, but your job is to sort of say that we have to tell the police exactly what happened, because if you want them to investigate it and deal with it as a crime, that we have to give them the information. Okay, so it's not really, you can't really withhold that information. If you know another sort of crimes being committed, like a robbery or something, then again, you can't say to someone, I can't tell. You're not a priest. And even they don't have the limits that they probably used to have many years ago. So if somebody confesses to a crime, especially a serious crime, you do have to tell the police. Otherwise, you will become an accessory to that crime. And if they find out that you've had the information and hidden it. But again, if you're really worried about these sort of things, talk to your manager, talk to the seniors who've been around longer. Okay, the duty to share information for individual care is as important as the duty to protect. So again, your policies will have it nice and clear about how you do, but reflecting on what I was just saying about, there are some things that you do have to share with the police, then you do have to let people know that you can't hide it all. Also, you need to let people know that your manager or seniors in the organisation may well read this. Now, I'm not talking about the outside manager who comes in. They wouldn't really be reading that. But the manager in your care home has to know what's going on. So they should be able to read into everybody's case notes, because they will be part of the discussion about progress and review and what to do really again. So you need to say, if someone's unwell, if they're, I have to talk to my manager about that. I have to share this with my seniors so that we decide what to do for the best really. And again, if someone's talking about certain pains and you say, look, I need to get your doctor involved with this. If they say, no, don't tell the doctor, because they may be frightened, of hearing information, like they might think, oh, I might have a terminal illness, or I might have cancer that's developing out of this pain. I don't want to know. Well, you have to tell the doctors, because you have a duty of care. And so they have to accept the fact that GP will want to come and see them, and then how they manage that is how they take it forward. Principle 8 is one of the newer principles. So it's about informing patients and service users how their confidential information is used. And what we normally do is, when someone comes new into a care home, we tell them straight up. It's usually part of the moving in process that they will be given usually some written information. And part of that is to say about, case notes, and when we have to share and who we have to share and how we use the information. That sometimes we have to write it for CQC if they want to see a report. But if it's research, it will be anonymized. If it's about personal health and you're speaking to the doctor, obviously you'll just pass on the relevant amounts of information. Physiotherapists will only have so much information. So there will be something written out that covers this as part of the home policies, which you will share to them. We often used to get people, if they had capacity, to sign to say they were happy with it. But trouble is, if people say they didn't want to sign, well, you have to say, well, this is what I've got to do anyway. So it was all a bit difficult. So I'm not sure what they do now, whether people sign or not. But they do make sure, or they get them to sign to say they've had a discussion and they understand what the issues are. Okay, so that were the Caldicott Principles. So you need to sort of write a little bit about confidentiality, explain what it is, and then, explain the Caldicott Principles. Now we're going to have a look at the Data Protection Act, and we're going to have a look. The Data Protection Act is huge. It looks at all aspects. It's not just about health and social care. It's about all sorts of works, jobs, data all over the country really. Every country has one. The country you're living in, if you go online, you'll be able to find it. It's a sort of an international thing, and they're all pretty similar. They might have a few little differences, but they're generally pretty similar. Okay, but we're focusing on data protection in health and social care, not in offices, not in So why is it essential? Because it helps people feel confident that their information will be used appropriately in the way they would expect. It allows them some sort of control about how people use their personal data, and it enables the people who hold that information to know exactly what they can do with it and how they can keep it. If people don't feel confident the data is being kept securely, this could harm that relationship of trust, which is really important. If you're working with your service user, if you're allocated as a key worker, it's important to build up a good relationship and a good trusting relationship. If they feel that you're misusing their information, then that's, there's no balance of trust going to be there. So it's going to be really difficult for you to gain that trust. If you don't protect the sensitive data that you have, not only would you lose the trust of the individual, but you could be fined. There are penalties for not doing it. If you repeatedly don't do it, there are pretty serious penalties. Um, and there could be a criminal charge if it was considered willful negligence. So if someone sort of, got sicker or suffered badly because of your negligence in passing that information out, there could be a criminal charge, really. And obviously, fines, penalties, criminal charges, these sorts of sanctions would have a fairly negative effect on your job, really. So good chances that at the very least you'd be suspended for work, or it could lose your job completely. Loss of earnings, and that would really affect your reputation. And if your work was mainly in the care sector, it'd be quite hard for you to get another job, really. So it's certainly worth thinking about and making sure that you are following the policy of your organisation. So some of the common data protections in healthcare is people not being aware how to store their data properly, making some mistakes in storing the information. If they really knew that it was had a legal requirement, that might have made, they may have tried a bit harder to put things away properly. Losing documents have sensitive data, like not filing them properly, and they can't remember where they are, which if you're using electronic care records makes it harder, because you're usually filling in boxes on a system. But if you wanted to add a written report or an incident report or something like that, then you might write that up first and then think, okay, I'll add it later. And then if you're anything like me, sometimes you forget what you've called it, and then you have to look at it everywhere. And you could maybe not hide it, not file it in a private file, but it could be in a public file or something. Inappropriate disclosure of personal data, just saying the wrong thing. We all like a chit chat and a gossip sometimes, and we need to be a bit discreet, really, when we're going home. And sometimes we forget we're professionals. We talk about our day in a public place, on the bus, on the tube, when you're going home, and people overhear, and my goodness, you didn't know that they happen to know that person. So you've said so much that they've been able to work out who it is. And then, information comes back. Well, some people might just go and report it to the local authority anyway, or to the police, even if it's bad. Misdirected emails means that you could, this is a terrible one, not checking who you're sending your email to, and find out that you've sent it to the place where you do your shopping, or the supermarket or something instead. And therefore you've exposed very sensitive information. So being super careful when you press send. Unauthorized storage and access to patients' records. Unauthorized storage is more of an issue very often with paper records if you don't put it away in the right place. But like I said, if you don't file things in your electronic system appropriately, you could be in the same pickle. As well as nowadays, most people working on the same system, they might have a lot of shared files and things like that, or folders where everyone has lots of access to. Some of your duties, you need to be aware of your duties. The first Data Protection Act was 1998. The second Data Protection Act was 2018. Duties haven't really changed. The third one is, I think it was 2020, the GDPR, and really duties haven't changed much there. So you could just say duties under Data Protection Act in general. You've got to keep your records up to date with what you do with your patient's information. So you put everything's in the wrong place. You don't just start doing later on. You go, I won't bother filing that away. You ensure that any paper files are locked or secure. So they're either locked down with passwords or they're securely locked in a filing cabinet. Electronic records are protected from unauthorized access. And now, like I said, you've got to go through what is reasonable. Nowadays, people can hack into everything if they've got the skills. I mean, you can't do everything, but as long as you've done what is considered to be reasonable, and reasonable will be that your organisation will have a process. So if they tell you, you know, how they want you to put a password together, you know, whether you're using, you know, a 20-letter password with capitals and small letters and, you know, special. So as long as you've done that, then you've been considered to do the right thing. Ensuring that all staff are aware of the importance of keeping sensitive information. That's really up to training, and normally data protection is something that has annual or 2-yearly training, usually just a short workshop, but everybody has to sign to say they've attended it so that the organisation can show CQC and their funders that they, you know, they are doing this, they're reviewing this regularly. Ensure all personal data is disposed of using the correct procedures. When you're delivering care, you're normally expected to keep care records for so many years, and then you normally follow the NHS policy to do that, especially again. They may well be scanned if they were hard copies before they scanned to electronic, but you would get guidance from CQC and from the local NHS on what you would do. But there are some bits of information that you dispose of. So if, say, if someone's died or moved on, or if the care home is closed, then you wouldn't leave documents hanging around. They should all be disposed of, and there would be proper procedures for disposal. They're usually incinerated. If you take a phone call from somebody, and you just leave a note about with someone's phone number on it, that needs to be disposed of afterwards. It shouldn't be just left around, so because it'll end up being left lying around in the wrong room. So if it's a regular relative and you need their number, then you'd put it into the patient's records in the right place. If it's someone who's never going to contact again, then you just get rid of the number. So ensuring that any staff who deal directly with patients are trained and keeping up to date. As I said, over my sort of career time, data protection has changed at least 3 times, and probably more than that actually. So that's why it's important to have like once or twice yearly training, so that people can be up to date with the most up-to-date legislation in case there are any changes that are relevant. Then it's the managers and seniors' responsibility to update and review their policies to reflect any changes in the data protection process, which they will do. And then it's your responsibility to make yourself familiar with those. And finally, one of the most important things is to ensure that any suspected data breach is reported. Now, it goes to the Information Commissioner's office, but you might have different procedures. So say you're working in a care home, if it's a minor data breach, it's, you know, you tell your manager and the manager will decide what to do about it. They might report it to CQC or the local authority. If it's a very serious data breach, such as hacking or something like that, they would report it locally, but they would also report it to the Information Commissioner's office as well. If it's just a one-off thing where someone's, you know, left something out and then forgot about it, then they would maybe have to go and do training again, and it would just be reported and held, because the Information Commissioner cannot take information for minor breaches, you know, thousands and thousands of them. They wouldn't be able to deal with it. But if it was a major breach like hacking in and, you know, or a long-standing breach, I'll talk about that a little bit more elsewhere. GDPR versus Data Protection Act. The Data Protection Act, I said, is the original document, and GDPR is the new one. Now, the assignment doesn't ask you to identify, but it does mention the 1978 Data Protection Act. It doesn't ask you about GDPR because maybe the assignment's a little bit older. You're lucky. So have a little read about a little bit where it's changed. It has changed. There are some key differences, and it's about consent. Really, consent must be explicit for data processing. That means you should only request what you need and not ask people for what's more. So, but I'm going to give you a chance to have a little look at that. You don't have to write about it a lot in your assignment, but I'd like you to be familiar with it as well. Okay. Nowadays, GDPR, they say you absolutely have to have someone who's got a responsibility for data protection compliance. If it doesn't already exist, and if it doesn't fall under another role, really. So if you've already got a data protection officer, fine. Now it might be the manager. In a small care home, the manager might hold that responsibility. If they have the responsibility of the Caldicott guardian aspect, they will, or they might have given that to one of their seniors. They might ask them to take responsibility for data protection as well. And that responsibility is about, checking and reviewing, and being the one who does the updates to policies if there's any changes in legislation. Any data under GDPR, you have to report a data breach within 72 hours. That wasn't specific under Data Protection Act. They just ask you to report it. So if you've sent someone's care plan to the wrong person, or you've lost a file, it's got to be reported within 72 hours. Okay. So just to sort of check compliance with some of the changes in data protection, what was expected was people had to have a data protection officer if they didn't already have it, or someone who was doing that role. They might have called it something else. The Caldicott guardian role might well be data protection officer as well. Do they have a process in place to review what data is being collected? So part of the role of that officer is to just review and make sure they're only collecting data that's necessary, and they're not collecting data just because they feel like it or they sort of think it might be interesting. They normally have to get, if you're a very big organization, huge one, it would have to be signed off by the ICO. But if you're a small, say like a small care home, it's the sort of thing that CQC would sign off and say as one of your policies. When you're starting the home, CQC will see all your policies and just make sure they're all up to standard. And when they do their inspections, they'll come back and inspect those policies as well. You need to know that patients are aware, and as I said earlier, it's the sort of thing that when they move in new, it's the sort of thing it's one of the sheets that you would go through with them. If they don't have that much capacity, they might have dementia or maybe a learning disability where they can't really understand, then you would need to use their advocate. I mean, you would do the usual communication things like signing, all sorts of things. But if you felt they didn't have capacity to understand, you would really discuss it maybe with their next of kin and say, this is how we're going to do this, and they might sign it on their behalf. If not, you might have to bring an advocate in. Is there an appropriate retention period? You'll find that in each area there is a retention period for certain things, as I said, and most care homes tend to follow either the NHS or the local authority one, which tells you how long you've got to keep information for, because it links in with safeguarding issues, and it'll be part of their contract monitoring. So, and then you think to yourself, this is when you're actually working in the field, have you had any data breaches in the last 18 months? And if you have, what went wrong and why did they happen? So when the team gets together, it's something they should always look at. If you do have a data breach, you should have a bit of a debrief. If there are signs of data breach within your organisation, you need to notify the data protection officer immediately and make sure they record it all. If it's possibly just one staff member who's done something silly, then you just notify them, as I said. If it's large scale, then you would need to get onto the ICO. Okay. If it's a very severe breach, you need to notify them within 24 hours, because if it's like some sort of hacking, they could be doing it to other care homes, and it could be a willful thing. You don't know really, or it could be a way of stealing money. So need to get onto it pretty quick. And if they are doing it so they can steal people's money or something like that, then at least you've notified people. So if it does actually unfortunately happen, you'll have evidence to say that you've done the right thing. And then hopefully people's money will be refunded because you reported it straight away. Okay, so that's data protection, that's confidentiality. It's building on the information that you had when you did your level 3, so it should be reasonably familiar to you. I'm just going to talk through the assignment now, okay? So let's have a look at task 1. As this is a level 4 assignment, the tasks are looking for larger word counts than the level 3s. You've already noticed that, I'm sure. So task 1 is about communication skills. So 1.1 is to compare and contrast 2 theoretical approaches to communication in health and social care. If you think back to part 1, have a look at maybe go back, have a look at the video and slides for part 1. You'll know that I gave you 3 theoretical approaches. So you just need to choose 2 of them and do a compare and contrast. I've highlighted the command verb because this isn't one where you just do an explanation. This is one where you compare them and tell me how they are different. Okay, show me what the differences are. So have a look at that. 1.2 is describe the main types of communication utilised within health and social care. We went on to look at that also in part 1, okay, in the part 1 work. We looked at all the different types of communication utilised within health and social care. You might not have room to write about everything, but at least think about the main types of communication. Is it written? And how is it used? Is it verbal? How and why is that used? Is it telephone? Are you talking to different types of people? So is there formal communication? Is there informal communication? And informal, is that when you're just having a chat with the service user to gain their trust, to develop a relationship? Formal is maybe when the doctor comes to see them and you're talking in a more sort of professional way. You might want to make a comment about the different approaches that you take. So the main types of communication, and make sure you keep that focus on health and social care. So don't just give me the main types, of communication in the world, but it's really all about what do you use day to day in the care field. So task 2 is a bit larger because there are 3 criteria for it. So you have 750 words. So as you can see, we're assessing that most criteria takes about 250 words. Now, you know that you can balance them differently if you feel like you want to say a little bit more about one than the other, but that's your main rule of thumb. 2.1 is talking about the main barriers to communication. What are they? And again, there are a lot of barriers, so you need to think about, you want to get a good few down. I need more than 2 or 3. Okay, so you need to be fairly succinct, and give me examples. 2.2 is identify a variety of alternative means. And we know there's lots of alternative means, but we want to think about people with special requirements like disability, hearing loss, visual loss, learning disability, physical disability, vocal, people who have no speech. That's a big clue. Think about that, really. That's very important for communication. So what alternative means? Again, we addressed that in part 2. So you want to go back and have a look at video and slides part 2 for this. And there's some attached reading as well. Explain the importance of confidentiality is 2.3. So now we're looking at what we've just done today in part 4. So I've highlighted the 7 Caldicott Principles. So give me what is communication, and then explain the Caldicott Principles. Your third and final task really is 3.1. What are the benefits and challenges of ICT in health and social care practice? Now you can give me a little overview there, and then of benefits and some challenges, but really we want some focus in how service users have benefited and how practitioners. Keep it down to ICT and not technology in general, because there's too much there for you to write about within that. Okay, I think it's 750 words. All right. Check that, actually. It might be 500 words. Okay, and then 3.2 is explain the Data Protection Act and its application. Now, the Data Protection Act is huge, so you need to have a very clear and succinct overview. Okay, so I want a summary of the Data Protection Act with just, about the 5 or 6 main points, really. Okay, you won't have room to do much more. Some things I want you to remember. Do have a look at your extra reading, because you'll get some references from there. Don't forget to give me examples of things as part of your explanation, like I gave you some case study. You don't have to put it in too much detail. An example only needs to be a short sentence, but if you put it into reality, it can help explain what you're saying a lot quicker. Referencing. This is a level 4 course. You absolutely have to do good quality referencing, and we're looking at a much more professional approach now from the level 3. Okay, so you must identify all sources, all methodologies, all application that you've used. You need to make sure the citations are in your body and the list of references are at the end. Okay, a lot of marks will be lost for no citations. And you must use a Harvard style, because that's Qualifi, who are the awarding body. That's the style that they want. Okay, there are lots of different, well, there's several different styles for referencing, but we'd like everyone to be do it in the same way, please. You must express your ideas clearly, and you must ensure you use the appropriate terminology. Don't use a complex phrase when a simple one will do, but I want to show by using some of the appropriate terminology that you've learnt, that will show your knowledge and understanding. And using the appropriate technology, will give you marks for accuracy as well. So if you leave out some technical terminology, then you won't get as good mark as if you put it in. But if you put it in and you get it wrong, you will lose marks. So really, only use what you're confident about, but please use it. And also, when you're doing that, check the spelling. Thank you. Word count policy. The policy has to be plus or minus 10%. Okay. If it's less than 10%, then you probably haven't written enough this room. You could have added another example or done a bit more. If it's more than 10%, then it's unfair on the others who've kept to the same amount, for that you to get marked on more information than the others haven't put in. So people will get marked down. Now, 10% of a 1,000-piece essay is 100 words, so you should be able to work it out pretty clearly, really. You can't go over by more than 100 words. Okay. Now, these rules do exclude, if any of you are putting indexes or content pages, if you wish, any headings you've put in, so you can be a bit liberal with them, any tables or images, or any little footnotes that you've put in, or appendices such as your reference lists. Okay, or any other appendices. You have to be a bit careful with appendices though, because there's no real need for them in this sort of this question, because there's no. But if you're sort of showing a bit of research, a research table, that wouldn't be included. So remember, references don't count. Please don't forget to look at the extra reading. It gives you more information than just the slides on their own, and it will make people's assignment different. Okay, which means some of you will get better marks than others. And from that extra reading, as I said earlier, you can pick up references. Okay, that's it. Good luck. That's the end of the communication unit. Thank you. Bye.